So what's the difference between a rheumatologist and an orthopedic doctor? Hello, this is Dr. Siddharth Dambar, physician here at Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine. So in the world of musculoskeletal medicine, meaning treatment of conditions like arthritis, tendinitis, injuries, and back pain, there are a few different types of doctors and specialists that are involved. When would you see an orthopedic surgeon? An orthopedic surgeon is someone who's trained and specialized in utilizing surgery to treat arthritis and tendinitis. So an example would be, let's say you've had a bad injury and you have a fracture. Well, that might need surgery and you should see an orthopedic surgeon for that. Or alternatively, let's say you have really advanced hip arthritis and you need a hip replacement. In that case, again, a orthopedic surgeon is the right person to see. Within orthopedic surgery, there are different types of subspecialists. So there may be someone who specializes in hip arthritis issues and doesn't really treat shoulder issues, or somebody that does more trauma and maybe not as much, let's say, active sports kind of related injuries that require surgery. So different types of specialists within orthopedic surgery, but they're all focused primarily on utilizing surgery to treat your musculoskeletal issue. Next, you have rheumatologists. Rheumatologists classically are focused on treating inflammatory arthritis or autoimmune arthritis. So these would be treating conditions where a person's immune system is overly active and causing inflammation in their joints. That can include conditions like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, as well as gout or other kinds of related autoimmune issues. Focus on treating inflammatory arthritis. They may treat other types of arthritis as well, but it's sort of best defined rheumatology as treating inflammatory arthritis with medications and other treatments to help control the immune system to protect your joints. Now you have other types of physician specialists that are also involved in musculoskeletal medicine. Physiatry or rehab doctors are ones who are classically trained to treat your joints after you've had an injury. Let's say you've had a really bad trauma, you're being discharged from the hospital, now you need to spend time in a rehab hospital to recuperate. A rehab doctor or physiatrist would be classically involved at that time. A subspecialty of rehab medicine is sports medicine, where now they're treating people that have more acute injuries from their sports activities and now need to be treated and managed in that regard. You then have also interventional pain, which is a subspecialty of both rehab medicine as well as anesthesiology, where they are trained to utilize image guidance, x-rays in particular, but also ultrasound to treat various musculoskeletal conditions, in particular the spine, utilizing injectable treatments to treat your arthritis and tendinitis and back issues. Now, the reality is that there's a lot of crossover between these fields, namely based on an individual physician's specialty, their training, and their interests. For example, for me, while I am board certified as a rheumatologist and focus on treating a lot of inflammatory arthritis conditions, I also have a lot of additional training when it comes to image-guided injections with ultrasound and x-ray guidance, and that has led me to get involved in things like regenerative medicine and orthobiologics since 2008. But that all comes from that additional training. Which doctor do you see for your musculoskeletal issue? Realistically, there are kind of big subtypes, like let's say you need surgery, well, you need to see an orthopedic surgeon. You've got inflammatory arthritis, you need to see a rheumatologist. In the end, you should have a sense for who your specific doctor is, what their field of expertise is, and their interests and their experiences in to help guide you as to who you should see next. Hope that was helpful. If we can be of additional assistance, check us out at chicagoarthritis.com. And until next time, have a good day and live well.